We've learned over the course of the past 3 months that location tracking isn't popular, and as a result, it hasn't really been helpful to our contact tracing efforts.
2 months ago, a new piece of tech was unleashed designed to better help contact tracing in Utah and to help curb infections. So the KSL investigators wanted to know, is it working? And was it worth the money?
So far, the app's been downloaded 94,000 times, given over 500,000 symptom tests, and referred more than 15,000 patients to get tested, meaning only about 3% of the state is actually participating. So is that helpful to the fight against COVID? KSL investigator Mike Hedrick looked into it.
This is going to help us identify and protect others.
This was a sales pitch from the governor's COVID task force back in April.
It is the latest example of how Utah is thinking creatively and outside of the box.
It's for the Healthy Together app, and this bit of tech carried a hefty price tag, $2.5 million up front, followed then by $300,000 per month for the next year, totaling $6 million.
Has it been worth it? It has not worked as well as we would have hoped for the contact tracing aspect.
Tom Hudako with the Utah Department of Health says it was designed to help with contact tracing by utilizing GPS on your phone to track where you go.
Our hope with the app was that as a contact tracer sat down with a positive case, they would be able to look at the location data, location history in the app, and be able to use that to guide the conversation and have that conversation be more thorough in terms of being able to track where somebody has been.
It's that GPS option that was a big selling point for the state compared to other very similar free apps that were on the market that utilize what they call less accurate Bluetooth technology. But now,
and we'll be turning off location tracking.
That $6 million purchase will no longer be used for contact tracing. Hudako says fewer than 200 people have actually shared their GPS info with contact tracers.
We feel like there's definitely been an uneasiness on the part of individuals to share their location history with us. We feel like that is the primary reason why people have not engaged with the app.
So, has this app been useful for fighting the pandemic? Well, by and large, most local health departments are doing their own contact tracing for COVID. KSL investigators reached out to some of the counties hit hardest by coronavirus, as well as the state health department, and we found very few local health departments we talked to are actually using the data from the Healthy Together app. Only Utah and Davis counties have said that they've used it.
Right now, is the app useful to fight COVID-19?
We haven't really used it, so I can't tell you that whether it's useful or not.
Tara Capybond is the Infectious Disease Bureau Manager for the Salt Lake County Health Department, and she says as the state has opened back up, their job has gotten complicated. That's because back when most people were staying at home, they were only coming into contact with their immediate family.
I am calling you about your COVID-19 results.
Now, as people start leaving their homes more often,
when did you start showing symptoms?
Contact tracers are having to make anywhere from 30 to 50 calls per COVID case. That's stressing the system as health departments all across the state scramble to hire more tracers.
We have been very busy, more than ever before we started it.
What's consuming most of your time right now?
It's definitely contact tracing.
Now, of course, contact tracing costs money. Across the state, $57 million has been spent or budgeted so far. And Salt Lake County is the biggest spender, $4 million overall, including $500,000 alone just to cover the last paychecks for their contact tracers. That number is only expected to grow as counties hire more tracers.
So then we'll have about 150 total by next week.
Is that a lot?
That's a lot. Yeah, that's a lot to manage.
When are we going to learn that we need to be listening to medical experts in order to best navigate this pandemic?
State Representative Dr. Suzanne Harrison says she's questioned the Healthy Together contract since the beginning.
Do you believe this app was a waste of money?
I'm concerned that it was not an effective use of taxpayer dollars. At this point, if we're not even using it for contact tracing, what is the purpose of this contract and this app?
Yeah, that's a good question. State Health Department, though, says they are not going to cancel the contract, but rather use this tool to assess symptoms, find testing, and receive COVID test results.
We want people to engage with the app in a way that's meaningful for them, and so we'll focus in the areas where they've been willing to engage.
Others believe our money might be better spent elsewhere.
Do you believe at this point the state should cut their losses and pull the plug on this app?
I would love to see this taxpayer dollars redirected to things that we know will help Utah families, and I think now is a good time to reassess.
Mike Hedrick reporting. While the app will no longer be used for contact tracing, the state says it'll continue to use it as a way for folks to check their symptoms, find testing, and receive their test results until the contract expires.